Hi, I'm Katie. I'm a therapist here at Octave, and in this video I'm going to be talking about EMDR, which is something that a lot of people are curious about, but also understandably nervous. The reality, though, is that EMDR starts with preparation, not processing, and so in this video we'll share a bit more about what that preparation phase looks like in case you're curious about trying EMDR yourself. So EMDR stands for eye movement desensitization and reprocessing. And it is a form of therapy that is highly structured. It's in 8 phases, and it involves helping people work through previous traumatic or painful experiences in their lives. The process for EMDR is very similar, whether you're doing it virtually or in person. A lot of people do tend to do EMDR virtually now, given the convenience of being able to do that from their own home, not having to commute. The important things to keep in mind for doing EMDR virtually, just like any therapy session, would be to have a comfortable space, one that feels private, one that feels like you can really allow yourself to delve into what the processing, should that be what you're doing in that moment. Also, making sure that you have already worked through with your therapist some grounding strategies and coping mechanisms to ensure that if you start to feel a little dysregulated or dissociative, that you are able to get back to the present moment. And that involves a lot of the visualization exercises and the distress tolerance strategies that will already have been worked through. People tend to get wrong about it, that they think that it might involve like some hypnosis or that it involves jumping directly into really painful experiences. And so that's not all completely accurate. In reality, EMDR does involve a preparation phase, a history-taking phase, and then lots of coping skills building before anybody is asked to delve into any painful or traumatic memories from their past. Another worry that a lot of people have about EMDR is that they're going to be asked to relive traumas from their past. And while it's true that the goal is to try and process through things that have happened in the past, there's a lot of focus on what we call maintaining a dual awareness. And ideally, with a strong therapeutic relationship, they'll feel safe to delve into that together. In EMDR, there's a lot of focus on preparing the client so that they're ready to do the actual work of reprocessing later on. The preparation phase involves a lot of things. First of all, it's important to feel comfortable and safe with the therapist that you're working with. So there's a lot of rapport building. Also, history taking of things that have gone on in the past so that we know what we might be targeting, but none of that is done in detail. Then we're also going to work on grounding skills and making sure that you have coping mechanisms to use both in session and in between sessions in case you do feel any surge of intensity and feelings. We also want to make sure that you have support systems in place and feel ready to do the work, which is something that is mutually decided on with the therapist and the client. So, in other words, the therapist is not going to push you to start doing any type of processing of traumas before you both agree that you're ready to do so. Before we ever get into the processing part of EMDR therapy, we as the EMDR therapist will work with the client on establishing some safety visualization practices. And so one of the main ones that we visualize with clients or help them to visualize is the idea of a safe enough place, a safe, calm place that they can go to in their mind that is free of any distress, free of any disturbing memories, could be a real place, could be imaginary. But the idea is really for the client to be able to fully access that place when they're feeling maybe a little dysregulated or intense feelings so that they can come back to a place of being present in the moment to be able to continue on if that's what we choose to do. Therapist will also do a lot of history taking, including trauma history, but also history about strengths and resources and support systems that you have in place, all of which is going to be very important when you actually get to the processing itself. Therapist will also give you some psychoeducation about what EMDR is and what to expect of all the different phases of processing, as well as let you know what you can expect during the processing sessions themselves, which will come later on after the preparation is complete. So during an appointment where you would actually be doing reprocessing, generally you will have selected what we call a target that we'll be looking at in the reprocessing, and you'll identify an image, usually a statement that feels negative connected to that, and a preferred belief that we're trying to work toward. The actual EMDR itself can include eye movements, in which case they would be following either the therapist's hand back and forth or some kind of light bar. Additionally, some clients prefer to do tapping of their own, which might look like, tapping on their shoulders. Some also use tones, and that will all be done during the processing. And after a certain amount of time, the therapist will stop and ask to check in and see what's coming up. Sometimes a lot of intense emotions come up, and that's not necessarily bad. But again, it's important for the client to remember that they're always in control. So if things are starting to feel too intense, or they feel like they've had enough for the day and they want to stop, that's always available to them, and they're reminded that they can stop whenever they'd like to. What the therapist will do is check in with the client about where they're at and determine together whether they feel ready to stop. Sometimes time constraints will be the thing that determines that. But in any case, the therapist and the client will ensure that the client is in a calm enough place to leave the session feeling regulated. After a session of EMDR and in between, we do let clients know to expect that they may feel some strong emotions, they may have more memories or less of the thing that they were talking about. There aren't any hard and fast rules, but we do encourage the clients to, if they feel comfortable, writing down things that might come up for them that might be helpful during later sessions of processing. Also, they will be reminded of the support systems that are in place for them. That might even involve doing a brief check-in with the therapist in between if things are feeling really intense. But the idea is reminding them that anything that comes up is normal and that it's not a cause for concern and that it will be attended to at the next session. So ultimately, EMDR is about building enough safety and resources to be able to go in and work through some painful experiences from the past in manageable chunks. The best way to start doing that is to talk with a licensed therapist about your particular situation so that they can work with you to figure out what might be the best approach. So if you're considering trying EMDR, one of the things to be on the lookout for is making sure that the therapist you're considering has been trained in EMDR through a certified training with EMDRIA, which is the association that certifies all the trainings. And if you have any more questions about EMDR, feel free to drop them in the comments because we'll be back to talk more soon.